Welcome back to Sonia's Space. I'm your host, Sonia, where we have real conversations around lifestyle, self development, women empowerment, and everything in between. I'm so excited to introduce our guest, Dr. Angela Casey, a double board certified dermatologist. She's a creator of Bright Girl and a mom of three teen and tween daughters. Dr. Casey is passionate about helping young people build healthy skincare habits that truly last a lifetime. Thank you for joining us today.
Thank you so much for inviting me onto your amazing podcast. I'm so excited to connect with your listeners today.
Of course. And I'm super excited to have this conversation because we're talking skincare. So, for listeners who may be new to your work, I wanted to give you the opportunity to do a quick introduction of yourself, like who you are and what you do.
Sure. So I am a double board certified dermatologist and micrographic dermatologic surgeon based in Columbus, Ohio. So what that title means is that in my practice, I primarily treat skin cancers with a surgical procedure called Mohs micrographic surgery, where I surgically remove skin cancers on patients in office. I then examine their skin under the microscope in our lab until we clear all the cancer cells, and then I perform reconstructive surgery on them afterwards. I'm also a mom to three teen and tween daughters. So those are my two main roles in life, along with being a wife to an amazing husband. But it's really the intersection of those two worlds where I was seeing so many skin cancers and so much skin damage that could have been prevented with better habits and the right products from a young age. And then
Yeah.
mothering three daughters and trying to get them engaged and excited about skincare and getting them into consistent habits, which any of your listeners who have teens or tweens understands that that's easier said than done. But the intersection of those two worlds is what inspired Bright Girl Skincare, which is a skincare line that I designed to be safe and clinically tested for adults all the way down to teens. So safe for teens and tweens, but really with a mission of getting young people the tools and knowledge and empowering them to learn how to care for their skin and preventing damage long term. Our ultimate goal is to make a big impact on the skin cancer incidence, which is currently the number one cancer worldwide.
I really appreciate everything that you're doing. For me personally, I started getting into skincare in my late 20s, honestly. Like before that, I mean, I've heard of sunscreen, wasn't really putting it on. I think the only thing I put on my skin was a moisturizer or a lotion because I just didn't have the knowledge or the awareness for that. And I feel like now with social media and everything, I feel like the awareness of that and talking about preventative skincare is really coming into the light. And I appreciate all the hard work that you're doing with that. And also, I love your products. They are amazing. They're very gentle on the skin. I already have dry, sensitive skin, so it works really great on my skin as well. I just want to ask obviously, there's so much conversation around preventative skincare right now. Realistically, at what age should people start focusing on prevention? Is 20s really the best time? I know you mentioned your teens, but how much focus should you put on skincare in your teens versus like your 20s?
Well, a couple points I want to bring up. I would argue that skincare starts from the moment that we're born. You have a baby and your listeners know when you bathe her and probably put lotion on her skin afterwards, and when you take her out, you're putting sunscreen on her. So when does preventative skincare start? It starts from the moment we're born and we are caring for our skin. We don't just neglect the skin of our babies or our toddlers, right? We
Yeah.
nurture, but when does that agency kind of take over for our young people where they're kind of deciding for themselves how they want to care for their skin and what products they want to use to do so? And really, we see that starting around age 8 or 9, that our young people are starting to develop that interest. They're curious. Many of them at that age are even starting to follow social media and learn about things. They're watching influencers. So that's when they're really kind of establishing an opinion on their skincare. What we know from clinical studies and in the dermatology research is that the majority of skin damage that we encounter in our lifetime is going to happen between the time we're born and age 18. Those are
Okay.
typically the years that we're outdoors the most. We're out at recess, we're playing sports, we're at the pool. We just have more time to be outside. So every time we're outside, that sun damage is occurring and it's accumulating over time. And then when we get into our adult years, many of us have indoor jobs. Now, if you're a person that has an outdoor job, you're going to continue to accumulate sun damage. So, my argument would be that it's really critical to start preventative skincare in our childhood, in teenage years, which is when that damage is starting to take hold. The skin cancer that I'm treating in my office today did not start 10 or 20 years ago. It started in childhood when that individual was getting sunburns. And our skin is remarkable and it can repair a lot of that sun damage to a certain extent until that damage starts to overwhelm our skin cells beyond the point where it can repair. And that's when it turns to a cancer. So the sooner we can prevent, the better our prognosis is for lifelong skin health.
Thanks for the insightful information because when I think about skincare and putting the emphasis on making sure you have a good skincare routine, I just think about women being in like their 20s and their 30s. But you're right. Growing up, like even when we went out to go play or go to the amusement park or the water park or whatever it may be, we would put on sunscreen. But I did not know that it actually started damaging our skin as much around that time. So that's good information to know. So do you agree that sunscreen is the most important preventative product by far?
Yes, that's such a good question. If I had to pick my one product that an individual is going to use, it is definitely going to be sunscreen and preferably a mineral based sunscreen. So, looking for ingredients like zinc oxide or titanium dioxide, which have really comprehensive broad spectrum UVA and UVB protection, but also are much less irritating to the skin compared to some of the chemical sunscreens like the avobenzones, octinoxates, some of the newer sunscreens that are soon to be approved by the FDA. But those can be a little bit more irritating to the skin. So that's the single most important product. And really, when it comes to preventing skin damage and thinking about sun exposure as a whole, the name of the game is preventing sunburn. So I want to message that to your community. It is not bad to be outdoors. You don't have to live your life inside. You
Yeah.
don't have to avoid beach vacations, but it's really, really important to avoid getting a sunburn because we know that it's the sunburns, not so much chronic sun exposure, but the sunburns themselves that really lead to that damage, the inflammation, the injury to the skin, and are directly correlated with lifetime skin cancer risk.
And I do want to talk about or we talk about sunscreen, but obviously there's different steps to the skincare process. How
Mhm.
much damage do common habits like skipping, cleansing, sleeping, and makeup actually cause long term? Is that a real concern or more of a scare tactic?
It is a real concern and it all roots back to inflammation in your skin. So I
Okay.
mentioned just a few minutes ago that we want to avoid sunburns because burns obviously create a lot of inflammation in our skin, right? We see that manifest as redness, irritation, sensitivity, our skin's tender. So that's inflammation in our skin. Likewise, when we leave products on our skin overnight, for example, we don't wash off our makeup, maybe have dirt and sweat and other pollutants that our skin has come in contact with during the day. And those are sitting in our skin overnight. It's creating more of a low grade inflammation. And inflammation is at the root of damage, not only to our skin cells, but also to the collagen and elastic fibers that are within our skin. And of course, we know we want to nourish and support and protect those for as long as we possibly can. That is what gives our skin its resilience, its flexibility, its strength. So, anything we can do, any of those small steps we can take to minimize that inflammation so that we're supporting our skin is going to be a win. And washing your face at the end of the day is a big part of that. Likewise, I would say moisturizing your skin is an equally important component of that routine.
I know at times, especially if you're going out with the girls, if you've had a long day, I'll just use a makeup wipe instead of washing my face. Is it good enough? I know it's not as effective, but is it good enough to just wipe your face off with a makeup wipe, or do you have suggestions or things to look out for in makeup wipes?
Yeah, so I would say it is definitely good enough and
Okay.
definitely much better than not washing off that makeup. So there are going to be times, yes, that we're busy, we're on the go, maybe for our young people who play sports or maybe they're in performance arts, theater, dance, etc. That's much better than skipping this step. altogether. What you want to be aware of with makeup wipes is that many of them do have ingredients that can be irritating to the skin, but I think that's a very individual thing. So many of them have, for example, formaldehyde releasers, certain synthetic fragrances, other chemicals, sometimes some hormone disruptors that we don't necessarily want to put on our skin if we don't have to, but in a pinch, it's a very good option. And then there are also many good brands out there that more pure and basic in their components and their ingredients. So those are obviously going to be ideal. I don't have a specific makeup wipe brand that I love or recommend. I actually don't use them at all myself, but I would say given the choice of no washing or the makeup wipe, it's definitely
Okay.
better than nothing.
Okay. And I know we're talking about makeup wipes and washing our face. So I started getting into micellar water maybe 6, 7 years ago, but I've heard that it's better to use that than using makeup wipes. Is that actually true?
Yes, that's very true. And the reason being that the micellar water is a very pure formulation. It doesn't have a lot of those extra ingredients because just in and of itself, with the way that those micelles are structured to kind of bind the makeup, and then the aqueous component, which takes it away with water or even with just wiping it off with a cotton pad, it is a formulation that eliminates a lot of those extra other chemical ingredients that are potentially irritating to the skin. So, a lot of times we think about it in dermatology that the more products you apply to your skin, the more ingredients you're exposing your skin to, the greater chance of irritation or an allergy or a sensitivity. So,
Yeah.
along those lines, micellar water is a pretty basic formulation and a really great option. It's something I love. Actually, two of our daughters absolutely love that as an option for removing their makeup before they go to that facial cleansing step.
Okay. And I could tell when I use it, my skin feels really nice and clean compared to a makeup wipe because that's just a quick process and you're rubbing your face with the wipe too. So that's good to know. For someone trying to build a smart routine, what
Mhm.
preventative ingredients should people focus on? I know there's like the importance of retinol, vitamin C, a sunscreen for sure, but what are some preventative ingredients that we should focus on for your 20s, 30s, and your 40s?
I think a good way to frame this conversation is really kind of starting with what is the most, let's start with the most important in terms of the ingredients and then go down from there. So, what are at the bottom are the things that you could probably take or leave, but most important with prevention is going to be that mineral based sunscreen. So, we'll circle back to that. Prevention is everything, it's the name of the game when it comes to skin health because it goes back to that old saying, right? An ounce of prevention is worth a pound of cure. We get so much more benefit from preventing. It's just like brushing and flossing our teeth, right? If we never get that tooth decay to start with, we're in a much better position compared to letting the damage or the disease occur and then going back to treat it. So, same goes for the skin. Prevention is key. Sunscreen, number one. It's not the most exciting thing to talk about. Everybody wants to talk about the new and exciting, innovative ingredients. Sunscreen's been around forever, but single most important, every dermatologist will tell you that. Secondly, in terms of efficacy, clinical evidence for supporting are retinoids. Retinoids are a cousin to retinol, so they're in the same category. The retinol is the over the counter version, which is much less potent than the retinoid, which is the prescription version. So these are retinoid prescriptions such as tretinoin, Tazorac, different at the higher strengths are some brand names that your audience may be familiar with. But single most proven ingredient in terms of building collagen, helping to exfoliate dead skin cells and increasing skin cell turnover. So you're getting that brighter, healthier skin. At base, they also help regulate oil production in your skin and they unplug your pores. So when you're supporting that collagen production, it's going to lead to a much healthier, brighter appearance to your skin. It's going to make your pores appear to be smaller. I get asked by patients all the time in the office, like, what can I do? My pores look so large. What can I do to shrink them? Retinoids are one of the only topical products that you can apply that is going to really effectively achieve that. They will also help disperse pigmentation. So if you're an individual that gets a lot of hyperpigmentation,
Yeah.
if you have a lot of sun damage or freckling of your skin, melasma, those retinoids are going to play a really important role. So that's my number two. Number three after that is going to come antioxidants. So these are things like your vitamin C serum that act as an extra layer of protection along with your sunscreen for environmental stress. Oxidants are really going to work at that inflammation level that we mentioned earlier, helping to mitigate and dampen that inflammation that's so damaging to the skin. And in doing that, it's going to support that healthy collagen, those healthy elastic fibers, and really keeping those skin cells nice and safe. After that, I kind of lump in like the growth factors, peptides, exosomes. Those are kind of closer to the bottom of my list. They're the more exciting things to talk about. Really, when you look at the clinical studies, and I would also throw red light in there at the bottom.
Okay.
When you look at the clinical studies, those first three ingredients that I mentioned are so far above and beyond all those other ingredients that that's what we continue to circle back to. And again, I think I speak for most dermatologists when we really like to rely on the data and the evidence when we make these recommendations and not the cute marketing story.
You mentioned red light. So I'm starting to see a lot of red light advertisement on my social media, and I have never used it. So since you already brought it up, what is the importance of using red light?
Your algorithm knows that you're really into skincare if it's being
Yeah, pretty much.
Great
Yeah.
advertising. Yeah, I mean, it's a very strategic way. That's a natural hook for anybody who's interested in skincare and skin health. So, what do we know about red light? There is definitely evidence that red light helps with healing and recovery within the skin. There's even some studies that suggest that it may help support collagen production in the skin, not to the same extent that the retinoids that other in office laser procedures or that chemical peels do, but on a much smaller level. The issue with red light is that the studies are very, very limited. So we have very small sample sizes in the study. So we don't have a lot of robust evidence to recommend it. That's first and foremost. Secondly, there's so much variation in the red light devices. How far should they be from the skin? How long do you apply them? What's the mechanism? You have some that are like a wand that you wave around, and that's not going to do much. You have others that are a panel that sits way out here. We know it has to be close to the skin to have any efficacy. So sitting in front of a panel of red light's probably not going to do a whole lot for us. I mean, the other thing to consider with red light is that it is quote unquote radiation in a sense. It's light, and we know that many forms of light can be damaging to the skin. We do not have long-term data on how that's going to affect our skin 20 or 30 years from now. It's not unlike cigarettes. Back in the
Yeah.
day, everybody thought, oh, cigarettes, it's healthy, it's good, it's a natural substance until we realized it wasn't. It was cigarette smoking was promoted in pregnant women as a way to help soothe their stress. Well, come to find out it was
Yeah.
really, really bad. So that's where I'm going to park my opinion with red light. It's not something I will use myself. It's not something I will recommend to patients. Am I saying it's going to definitely be proven harmful? No, I don't think we have data that's pushing us in that direction, but I will definitively say we don't know what the effect is going to be 20 or 30 years from now.
That's really good to know because I'm pretty cautious about using different things or different products. And I don't use much on my skin anyways, but I've always been curious about red light. So that's good to know before I make any purchases. Last year, I was pregnant with baby Raya. And of course, when you're pregnant, your hormones, they're fluctuating, they've changed, and your skincare routine is a bit different. So, how should major life phases like pregnancy, postpartum, perimenopause, menopause shift someone's skincare routine? And what ingredients should we be cautious about?
Yeah, so I'm glad you mentioned those three periods in our lives because they truly are these eras of dramatic hormonal shifts. Think of what we go through during puberty and how everything's changing with oil production and our skin microbiome, inflammation, sensitivity, etc. Many of us go through that again during pregnancy, although it varies. Some people coast through pregnancy and their skin is glowing and it's bright and healthy, and other people get terrible breakouts. And same thing in the perimenopausal era. So, what we know is women, our greatest hormone is in greatest percentage is still testosterone. Many people don't know that it actually, the percentage of testosterone in all of us as women is greater than estrogen and progesterone. Our amounts of testosterone as women, of course, are much less than men, boys and men, still circulates as the predominant hormone when we're looking at sex hormones in any of us, man or woman. And it's the testosterone that is really responsible for a lot of the skin changes that are related to acne, inflammation, breakouts. So we have to kind of think of where that testosterone is sitting in relation to the other hormones, the estrogen and progesterone. We know too that estrogen and progesterone are very critical for supporting the collagen and elastin and the suppleness of our skin, which is why we start to see that trail off. Our collagen levels actually start to decline in our early 20s, and it starts to drop by about 1% per year on
Okay.
average. So it's important to factor that in as we're looking at skin changes throughout these various eras. When we hit menopause and those estrogen and progesterone levels, for many of us, kind of drop off a cliff, so does our collagen. And in many women, our collagen levels decrease by about 30% in the first 5 years after menopause. It's tremendous. And you think of how
Yeah.
that looks clinically, it's a big change in someone over a few years, which is why we circle back to all of these simple daily routines that we can implement to help support that collagen, to help regulate our skin's functions, and to minimize inflammation. Because when we're kind of protecting all of that with those daily skincare habits, we're not seeing as much of an effect, as much damage from those hormonal changes that are occurring.
Yeah, I think the important piece from this would be there's things changing externally, but we have to also understand and be in tune with our bodies, especially women, right? Puberty, pregnancy, perimenopause, which I feel like there's not much research in that field, but it's really starting to come out and people are talking about it, and then
Mhm,
menopause.
mhm.
So I think, going to go see your OBGYN and checking your hormones and just being mindful of how your body's doing internally is just as important, probably even more.
The external manifestation of everything that's going on within us. So you think about how our skin appears when we are sleep deprived, when we're stressed, if we're sick, if we're dehydrated, if our diet is not good, compared to how our skin looks when we're well rested and we're well nourished. It's a big difference. And there's a tremendous connection between our gut health, which ties into inflammation within our bodies, and then that translates to what we're seeing on the skin. So, in a very general sense, without getting into all the nitty gritty details, anything that we can do to reduce inflammation in our bodies with eating a healthy diet, making sure that we are getting enough sleep, making sure we're exercising is going to benefit our skin. There's actually some really interesting studies that demonstrate how a whole foods based diet actually reverse ages the skin. So,
Mhm.
individuals who had older looking skin when they were on that whole food diet, fruits, vegetables, proper proteins, the appearance of their skin actually reversed in age over time. And I think that kind of feeds back into that importance with the hormone conversation of what lifestyle modifications can we make to help support that hormone health. It's up to us as individuals to be educated on that so that we can then talk to our providers about whether hormone supplementation is right for each of us as individuals.
I was diagnosed with contact dermatitis when I was in college. And then it started getting better and then I got horrible flare-ups about 5 years ago and I realized it came down to my lifestyle and what I was eating and whatever I was consuming and I really had to make some changes and I feel like it's pretty much controlled now, but it really did come down to the spicy foods, the drinking, like I could tell I would get a flare up from that. So that's a really good point that you made.
I'm so glad you mentioned that, Sonia, because it really explains and kind of sheds a light on why so many individuals get breakouts of eczema, acne, sensitive skin during periods of stress. So think about our final exams in college. You think about when you're preparing for a big presentation, you've got a lot going on at work, you're not sleeping enough. Many times when that's our life situation, we see these inflammatory skin conditions really kick up. And it kind of gets back to that idea of the importance of mitigating stress and managing that to the best of our ability in terms of supporting our skin health and really dampening, again, all comes back to that inflammation.
Yeah, I've noticed it really does come down to inflammation when it comes to skincare.
And it's very individual. So you
Yeah,
mentioned in your case that you noticed specific dietary changes that were really impacting your skin. So I think an important message for your listeners is that dairy is not bad for everybody, gluten's not
yeah,
bad for everybody. Some individual alcohol is not bad for everybody, but for many individuals, they'll notice some degree of inflammation, and some people are extremely sensitive to those dietary components. One quick point I want to mention before we move on is that just looking at the clinical evidence, we know that high glycemic index foods are very pro inflammatory in just about everybody. So, processed foods,
yeah.
sugars, alcohol, it's going to kick up inflammation in all of us. And that's going to worsen conditions like acne, eczema, sensitive skin, blotchiness, etc.
The good stuff. The chocolates, the chips, all of
Anything that we
that.
really enjoy, yeah, not so good
Yeah,
for us. All things in moderation, just like the
exactly.
sunshine.
Everything in moderation. No, I totally agree. So let's talk skincare trends. I know we talked about it a little bit. Social media has definitely accelerated skincare trends, not always in a good way. What trends right now are actually harmful for our skin long term? Is there anything that you've seen?
So a couple things come to mind. The morning shed routines. Do you ever see these morning sheds where individuals go to bed and they've got on a face mask, like a plastic face mask that they peel off, eye gel
Mhm.
pads. They've got a silk bonnet in their hair, maybe a chin strap, and basically all these layers of skincare items, devices, and skincare products. And the idea, I don't know if this is true or if they're just kind of putting it on and then taking it off for entertainment value, but the idea is that they've slept in all of these items and then they're waking up in the morning and peeling it off one by one until they're like the butterfly coming out of the cocoon of all of these and their skin is glowing and their hair
Yeah.
is shiny and beautiful. I think there's a lot of like pageantry with that whole trend, but it's really, as dermatologists, it makes us cringe because we're looking at these individuals putting all of these products on their skin, those peel off face masks that often have vinyl or plastics in them that are the components. I don't know about you, but I don't want to sleep with vinyl and plastic on my face all night.
Yeah.
That doesn't sound appealing to me. So that's a big thing. The second thing that drives me crazy are the DIY sunscreens where people are getting like zinc powder and mixing it up into a paste and making
Oh,
their own
no.
sunscreens.
I've not seen that
So
yet.
there have been some interesting studies, active studies on these so-called sunscreens that most of the time only render an SPF between 1 and 5. So they are not nearly adequate despite what one might think. Substituting that for a clinically proven and studied sunscreen is a no no. And the final thing I would say is people going into their kitchen and pulling out ingredients, food ingredients, and whipping it into a face mask or skincare product. We
Yeah.
see some really bad contact dermatitis from that. We see irritation of the skin. We see skin barrier breakdown. Those, it's simply, again, not controlled, not meant to be applied to our skin in that way, and can be very, very harmful, actually cause much more harm than good in some cases. Another thing I've seen is individuals using like a sugar or a salt or coffee grounds as a face scrub. And that's creating lots of microscopic tears in the skin, which are then just a portal of entry for bacteria and setting the stage for more inflammation of the skin. So why tempt our skin with these
Mhm.
potentially bad ingredients when we have safe and effective skincare? I think people are always just looking for something like trendy, and these practices love to be hyped up on social media because there's entertainment value in it. But is it good for our skin? Probably not.
Yeah, there's that entertainment value, and also these are things that you can find in your kitchen, so you can easily just make it. How can people realistically tell the difference between marketing hype and truly science-backed prevention since we're talking about this?
Yeah, I love brands that have clinical studies that back up their claims. So I love brands that have done objective side by side photo documentation, that have made specific measures of aspects like skin hydration, skin quality, pore size, skin clarity, and that we can really look at that objective data instead of again, focusing on the cute story that goes behind a brand. That being said, I do think that brands that have a purpose or a why behind them are quite powerful. And that appeals to the emotional side of us as individuals. We all want to support brands that have a good heart, that are rooted in that authenticity and that want to help people or that want to provide a solution. I mean, that was why I created Bright Girl Skincare. I saw this void in the market with brands that were really speaking to Gen Z and Gen Alpha with ingredients that were properly selected, that had clinical data to back them up, that had those studies to support it, but then branded in a way that was going to really connect with that audience in a way that many of the legacy big mainstream brands simply weren't because that wasn't their role. Their role was to provide a nice body lotion, but it was unscented. It was in a bland white bottle. My teens weren't so interested in using that. So I think clinical data is important. We completed full IRB approved clinical trials with the Bright Girl line. As a dermatologist, when I'm evaluating skincare lines for us to carry in our office or that I'm going to recommend to patients, I always go back. I go back to the white papers and I look at the data and I look at how products perform compared to others and really taking that into account when I'm making recommendations. With all of that being said, as individuals, I think we're going to gravitate to products that work for our skin, that we experience that immediate positive feedback. We like the way it smells, we like the way it feels. It lathers nicely. It absorbs beautifully. How does it spread? How does our skin feel after we apply it? And that's where we're going to kind of land. And that immediate positive feedback is going to draw us back to continuing to want to use the products and get excited about using it. So I do think that that's important. But a lot of what's on social media is individuals sharing their experience with a product, and they generally have glowing, beautiful skin. And that's great. And that's their experience. So you have to take that for what it is and understand it may not transform your skin. And then it's up to you as the consumer to decide how you want to proceed.
True. Okay. So I love to end on reflection. What's the best skincare advice you would give to your younger self?
I would say don't use the tanning beds. One thing I could go back and do. I've had more sunburns in my lifetime than I can count. So I would go back to the sunscreen as number one. I wish I had been more consistent in preventing sunburns when I was younger. But also, I grew up in an era where it was all about drying and stripping the skin. So anything we could do to get oil and everything off of our skins, we use these harsh scrubs and very potent astringents on our skin. And looking back now, and with all I know, that was the exact opposite of what we should have been doing. We should have been nourishing and supporting and protecting our skin and trying instead of trying to kind of tear it down as we did.
Okay. Well, thank you for that. So, for everyone who is definitely going to want to learn more from you, but where can they find you and connect with your work?
Yeah, so you can find us on social media at Bright Girl Beauty. It's all one word, BRIGHTGIRL Beauty on Instagram and TikTok and Facebook. And then you can find the Bright Girl products at www.brightgirl.com.
Do you guys carry a sunscreen line as
We
well?
do. We have
Okay.
mineral sunscreens. We have both a tinted and a sheer version. They're beautiful, SPF 40, SPF 44 waterproof, really, really gorgeous formulation. Sunscreen was top of mind and of premier importance when I was formulating this line because as we said earlier, it was the most important of all of the products. So we really had to deliver something that was elevated and exceptional and different from anything on the market. And I think we've achieved that.
Okay, so I'm definitely gonna check it out and order that for myself, so
Oh my gosh,
definitely try it out, so
that means
thank
so
you.
much. Thank you, Sonia.
Of course, of course. So, Dr. Casey, this was super informative. Thank you so much for being here and for the work you've been doing to bring clarity to skincare. And to my listeners, if this episode helped you rethink your routine, make sure you share it with a friend, leave a review, or follow Sonia's space for more honest conversations around lifestyle, self growth, business, and women empowerment. Until then, see you next time.